I'm Dr. Ginevra. I'm a physician with fibromyalgia myself. Frida Kahlo is one of my heroes. She is thought to have dealt with fibromyalgia along with significant chronic spinal pain. I have a ridiculous and rather embarrassingly large collection of books about Frida Kahlo. In one of them, which is Frida Kahlo, Her Photos, which is 400 photos extracted from her personal archive of more than 6,000 photos when she died. In that book, I stumbled upon this x-ray of hers, which is from a few months before she died, and it's of her lower back. And it really blew my mind for a few reasons. One, it feels so personal to really see, inside her body, literally. The other is when you see this x-ray, you don't have to be a radiologist or even a doctor to see that this is not normal. And looking at it just even makes my back hurt. And I wanted to just briefly go into a little bit about what this x-ray shows and how her pain, how she expressed that in her art. So Frida Kahlo, when she was 18, she was in a bus accident in which she was impaled by a metal rod. She almost died. She had multiple fractures throughout her body, including at least 3 spinal fractures and several pelvis fractures. She, over her lifetime, had over 30 surgeries, most on her back. And after each of these surgeries, she would have prolonged periods in traction. She'd be immobilized in bed or in plaster casts. Later in her life, she wore these steel corsets. And her low back, in particular, was a constant source of pain. And ended up showing up in her paintings in interesting ways, and I'll show you that in the next slide. But before we do that, I just wanted to briefly kind of show you what is going on in her spine here. So if you look up here, you can see more normal spinal vertebrae, and you can see how they're kind of spaced out, and you can see that within there's a disc. And then as you get to her lower vertebra here, you can see here there's actually an area where there isn't any bone, and that is definitely abnormal. You can see the multiple fusion attempts that she had, and this was kind of the last attempt that they put in. But down here, all of her vertebrae really have kind of fused into one. It's almost like if you think about this like a column and the base of it is crumbling and kind of compressing together, that's what's going on in her lower back here. And this is going to generate, this whole picture is going to generate intense amounts of pain, inflammation, and immobility. Vertebrae that have really fused together into one don't move very well. And we know that she was basically bedbound or in a wheelchair for the latter months of her life. And she actually died a few months after this x-ray was taken. Here you can see the connection between Frida Kahlo's life and her art. So over here you can see a crumbling spinal column. And here in this painting called The Broken Column from 1944, you can see she actually drew her spine as a crumbling column. Then she has dressed herself in one of the steel corsets she was forced to wear. And you can also see all the nails that she put throughout her body. And this painting is actually one of the paintings that led a group of Mexican rheumatologists to who had kind of reviewed her journals and paintings. This is one of the paintings that led to them thinking that she had the more widespread pain that we see in fibromyalgia, in addition to the more localized spinal pain. And when I see this x-ray and I see how she so beautifully really bared her pain to the world, it reminds me that she was the ultimate in fibro fierce. Stay fierce. Thanks for joining me.